Right here is the fimbria. The funnel part right here is the infundibrium. There's the two oviducts right here. So the uterus sits on top of the urinary bladder right here. So the vagina is right there, and then this is the urinary bladder right here. And then you can see where the two ureters are coming in from the side right here. Those are the two ureters. Now this is the boy bladder right here. And so the boy bladder has
guys can hold their urine for
bigger bladder, I think. And then if they're not pregnant, of course, they don't have a uterus like pushing down on it.
guys can hold their urine for.
They have a bigger bladder capacity, slightly bigger. Okay, so this is, we've got some ligaments here too. So here, that's actually the Uranus ligament right here, or medial ligament right here. It's one of the ligaments that suspends the bladder. Here, we've got some structures right here. So this right here are the two ureters coming in on the side. And if we look on the inside, this area right here looks like a triangle. We call that the trigone. So on the posterior inferior side is where the two ureters are going to enter. And then this is where the urethra exits, right here. And so the smooth muscle layer here, the smooth muscle layer is the detrusor muscle. And in this portion of it right here is where we have the internal urethral sphincter. It's involuntary smooth muscle. So the bladder, when it stretches, it causes it to distend. But when it gets full enough, an afferent signal gets sent to the central nervous system, and it will send a signal back, an efferent signal back to relax the sphincter. And so then we get the urge to micturate, which is to urinate. But we've got a second sphincter that is in the urogenital diaphragm, like the pelvic floor muscle. That is your external urethral sphincter, which is a skeletal muscle, and that's where you regulate or control like whether or not you're going to micturate at that moment. And that is the skeletal muscle part. And so it's going to be right underneath the prostate gland that you see right here. Okay, so on the inside, this is the mucosa layer. The mucosa layer is lined by a transitional epithelium layer, which is capable of stretching extensively. And so it has fewer layers after it's stretched out. It can stretch and recoil. Once again, you can see the trigone, and then you call these little ridges, you do call those like a rugae. I don't know if I have that on the test, but they're like expandable little areas. Now, some of the reproductive parts, so I realize we're not there yet, but let's look at some of the reproductive bit right here. So here, coming along the sides of the bladder and then going posterior, these are the ductus deferens right here. And the ductus deferens are going to come together here, and these two glands in the posterior side are the seminal vesicles, and they contribute like a sugar solution to the sperm that's coming down. So the sperm does not have motility when it's in the ductus deferens. So it's propelled in the ductus deferens via peristalsis by smooth muscle contraction. But once it's the secretions of the seminal vesicles or seminal glands are added right here, that means that we now get motility. So it includes like a sugar, like a fructose type solution for them. And then they go into the ejaculatory duct. And we can't see that, but these little parts coming together that they go into the prostate, these are the two little, these will be the ejaculatory ducts when they enter the prostate. So there's two little sides. It's like they're paired structures, and they're right here. And then in the prostate gland here, we'll have the prostatic urethra. And so the ejaculatory duct is going to join that from the posterior side. So there's a prostatic urethra. Then we go through that urogenital diaphragm that I talked about earlier, and that is the membranous urethra. And then we go through the penis, and that's the penile or spongy urethra. So in a male, that's about 20 centimeters long for the whole urethra. And in females, it's about more like 6 centimeters, or might be less than that actually. So it's considerably shorter. So some other parts on here. Okay, so here's the kidneys right here. So the outer part is the cortex right here. And all of these little red lines in the cortex, those are the cortical radiate arteries. And branching from those are where you're going to have all of the afferent arterioles. This is the arcuate artery and vein, the arcing part right here. This whole layer is the medulla right here. So cortex, medulla, fibrous capsule right here. That looks like that's pararenal fat right there. So these are retroperitoneal. They're behind the peritoneum. Okay, here, dripping from the renal papilla, which is this nipple-like bit right here. The urine drips right here. So these are minor calyces right here. And the urine goes to the major calyx, which should be right here. Then the part here is the renal pelvis. And then the ureter is what goes down to the urinary bladder. Now, some other bits of information. The adrenal glands are right here. Some blood vessels here, which I guess we've already done blood vessels, haven't we? But here's like celiac trunk. This is, those are the phrenic ones, arteries right there. This is the superior mesenteric artery. This is the inferior mesenteric artery. These are the renal arteries and veins right here. And these are the gonadal artery and veins right here. You can see those. And you'll notice that the left gonadal vein actually goes into the renal vein right here. And so down here, and you're just not showing everything right here, but the vein right here, it looks like a net. It's like a reduction in heat exchanger. Not well shown on here, but it's called the paniform plexus, and we'll see it better when we do that system. But in the same area, you've got a bunch of stuff bundled together, and you can't see it on these models. It's called the spermatic cord. And that descends through the man's abdominal cavity in the front right here. And he goes through a canal called the urogenital canal. And that's a weak spot that intestine could poke through and they could get a hernia. And so it descends down into here, and so that's where the testes descend through. So they call it the spermatic cord. It's got the ductus deferens, it's got a testicular artery, the testicular vein, testicular nerves, and you can't see it on this model. But it all goes down through the, like I said, through the inguinal canal, which is a common spot to get a hernia, actually.